Welcome to our brand new training series, OET Medicine Speaking Roleplay Interventions. This series is going to completely change how you prepare for your clinical communication criteria. Instead of lecturing you on broad grammar or vocabulary, we are putting real candidate setups under the diagnostic microscope to show you exactly why you might be getting stuck at a 330 or 340 score. Today we are tackling one of the highest stakes, highest anxiety scenarios you can face on exam day. A post-operative hospital ward patient who is completely furious, has their bags packed, and is demanding to discharge themselves against medical advice. This is a classic trap card where your clinical communication is tested to the absolute limit. Let's watch how a typical low-scoring candidate handles the crucial opening minutes of this high-tension consultation.
Hello, Mr. Jones. I am the attending doctor on the ward today. I see from your medical notes that you are packing your bags and you want to leave the hospital against medical advice. I must inform you that this is a very dangerous decision for your health and you could experience severe complications or even a relapse at home. Can you please stop packing, sit down, and tell me exactly why you want to leave so I can fill out your discharge paperwork?
Stop right there. Let's pause the tape, because Dr. Patel just walked straight into a massive template trap. He went immediately into a rigid, confrontational checklist. Let's diagnose exactly why this fails the B+ criteria. Look at his first move. He didn't validate the patient's obvious anger or high-stress state. Instead, he went straight into a medical lecture, telling a furious patient that their decision is very dangerous. When you lecture an aggressive or reactive patient before establishing a clinical bridge, you don't show empathy. You put up an immediate emotional wall. The patient is going to spend the next 4 minutes fighting him on safety statistics, the entire consultation timeline will collapse, and Dr. Patel will run out of time before he even glimpses a clinical management plan. Let's hand the keys back to Dr. Patel and run the course correction simulation.
Wow, hearing it back under the microscope is a complete wake-up call. I realized that my focus on memorizing the safety warnings on my roleplay card was making me sound completely robotic and confrontational. I was trying to satisfy the bullet points on the text card instead of satisfying the real clinical criteria. Instead of listening to the patient's immediate emotional state, I just read a textbook script at him. Let's try this again using the dynamic structural protocol. Hello, Mr. Jones. I can see you've already got your bags packed and you look incredibly frustrated with your stay here on the ward. I want to make sure I understand exactly what's going on so we can get you home as safely as possible. Before we look at any of the official discharge paperwork, could you walk me through what's making you feel ready to leave today? Let's talk about that first.
Notice the massive structural shift. Dr. Patel didn't work on his grammar, he didn't memorize fancier medical vocabulary, and he didn't change his accent. He replaced conversational passivity with structured clinical leadership. He validated the tension, established a mutual safe harbor, and signposted the agenda to maintain total control of the consultation timeline. That is what a B+ looks like under pressure. Now, as I mentioned, this is the beginning of the OET Medicine Speaking Roleplay Intervention series. We want direct feedback from real international doctors to see if this format helps you see your own structural leaks. If you found this case breakdown valuable, hit that like button right now. More importantly, drop the words "next episode" in the comments below. Your responses tell us if we should keep producing these clinical interventions for other complex ward and clinic scenarios. Or explore the complete OET Medicine Speaking Mastery playlist on our channel page right now. I'll see you in the next episode.